guys, and welcome back to Nursing with Sarah. Today I'm going to be talking about some essentials that you need for placement. So obviously this is different to when you're at uni, but when you're on clinical placement, these are like my essentials that I think are quite important to have. And I've got like 9 things that I think, well, that came up to the top of my list, and I thought to share with you guys today. Number 1. The most important thing that you need to have is comfortable nursing shoes. When I first started my nursing, I thought to go the cheap option. So like I got some black, they're nursing shoes. That's the funny thing, they're actually nursing shoes, but they were like maybe like £39. Everybody was getting these other types, which I think were like £60 or £70. But I just wanted to go cheap. I thought, what's the point? Get something cheap. However, I can tell you now, it didn't last for a year. So my advice is to get something, you're literally investing in your shoes. It has to be black, it has to be waterproof, and most of the time it has to be solid. So waterproof because you need to be able to wipe off any bodily fluid that goes onto your shoes. Solid in terms of leather or solid is because to protect you from needle stick injury. If a needle was to drop on the floor, if it was material, it can go into your shoes. So depending on your trust guidelines and your university guidelines, most of the time they would want you to have black leather waterproof shoes. I'll try to insert some pictures around here just to give you like an idea. In the community, however, you can wear all black trainers. So most of my placements are in the community, so I tend to just wear black trainers. Again, as long as they are solid, waterproof, something that you're comfortable with. Especially in the hospital, you're going to be on your feet. Like, it's a 12-hour shift, so you're on your feet quite a lot. So try to get something that you know that you're comfortable walking in. But ultimately, what you need to look at it as is that you're investing in your shoes, just so that you're not buying shoes every single time. Because like, for example, I'm having to buy new shoes now, and it's only been like 2 years in. As I said, my first nursing shoes didn't last more than a year. Number two, I would always advise to get a small notebook. This was, I can't remember where I bought this from, but it was a 2-pack, and literally it's just so handy because it can fit into my pocket, it fits into my tunic, and anything that I feel like I might forget, any important information, I literally just note it down here. Especially in your first year, when you're still trying to remember a lot of things, your notebook comes in really handy. For example, knowing the 5 to 7 R's of before medication. You might not know it by heart, like, you know, right patient, right time, right dose. So you might just write it all down. I remember that's one thing I wrote down, and it was very handy for me. So every time I had to give medication or something like that, I would go into my book and sort of feel like, oh, okay, I've done that, I've done that, I've done that, I've done that, I've done that. In my notebook, I also put down observations. I don't write any patient's details. You're not allowed to write any patient's details, or any confidential information. But I normally write down, for example, like number 1, which would signify, let's say, bed 1 or the first person I've done, just for me to remember. And I write down their observations. And that was because in my ward, I wasn't able to take in the computer to every single room. Again, because it's infectious disease, you can't just take in things in, because most of the time you need to just go in, wear your PPE, come out. So I used to find it quite handy just writing it down, and then once I'm done, put them all onto the computer, onto the system. So that is number 2. Number 3, I can't emphasize this enough. You need pens, like pens and pens. Like, what I normally do is, especially in the community, my pens are always in my pocket, and I literally just, there we go. So yeah, pens is such an important thing. You're always going to need pens. You look so disorganized when you're like looking at the nursing station for a pen because you don't have one. In the community especially, I feel like you need pens more. In the hospital it's not too bad because you've got a computer system, so most of the time you're either putting things in the computer. But in the community, you're having to write your notes, you're having to, so in with every patient that you go into, you're having to write a lot of notes. If you give insulin, you've got the med chart, the MAR chart to fill, you've got the glucose chart to fill, the BGT chart to fill, you've got your clinical notes to fill. Everything is written by hand, so pens is so important. I find it a bit helpful just buying a whole pack of pens just so I don't lose them. Yeah, because they go so quick. Like, you actually lose the pens so quickly. I started a week with maybe like 4 or 5 pens, and by the end I'm actually looking for pens, like there's nothing left. So pens is so important. People ask to borrow pens and you end up giving it and you end up forgetting to take it back. So again, that's how you lose your pens. So always try to have pens with you, have spare pens in your bag, and yeah, very, very important. Number 4, so another must-have is a water bottle. I'm naturally quite bad at drinking water, so with me I make sure I have a really nice bottle that looks nice. So I have a water bottle which is a constant reminder that I need to drink water. On the wards, because you're always on your feet, you're always going around, you always got things to do, you always forget to drink water. And they always say the nurse's bladder is one of the worst bladders. We don't do ourselves any favors because you're on a 12-hour shift, you're not drinking water, you're hardly going to the toilet. So try to remember to drink water, and the easiest reminder is to get a nice bottle that will entice you and remind you to drink water. It's easier, I guess, to drink water in a hospital because you can always have the water bottle somehow at a nursing station, for example. But if I'm in a community, I just remind myself to drink water every single time I leave the patient's house. So the water is in the car, I go in to see my patient, I come out, drink some water, going to see the next patient, come out, drink some water. And these bottles are really good because they keep your water cold. So I literally fill it at the beginning of the day. Once I get back into the office about 12 o'clock-ish, I refill, and then before I go, maybe after lunch or something, I refill again. So that's how you're getting in your water, making sure you're going to the toilet. Especially in the community, you feel like toilet breaks are one of the hard ones, so you tend not to drink water. Don't do it. Drink water, guys, drink water. So my 5th must-have is one of these. I think it's called a pocket wallet. Yeah, I don't know, if it's not, I'll check what the name is. But one of these pocket wallets, they are so good. Like, I literally, I know some people's pads are now like online, so you got e-pads. However, like, we're still using the actual pads that are on paper. So it fits in my pad and OAR, and I literally close it up. It fits into my bag. Here we go. It fits into my bag very nicely, very handy, so your pad never gets dirty. There's a lot of students that end up having like coffee spills and all of this all over their pads, and it doesn't really look nice. Your mentor looks at you like you're a bit disorganized. What's going on? Why is your pad so dirty? And especially like your OAR, you've got that for 3 years, so you have to keep it clean for 3 years. Your pad, at least that changes every year, but having your pad for 1 whole year, things are bound to happen. So I find it easier just to have them all in this pocket wallet, and they fit nicely into my bag. At the end of my shift, I bring it out, my mental signs, and that's about it. And we also hand it in this way as well, so I find it easier to have these. Another must-have, Fob watches. So like most of the time when you go for your open day anyway, like Freshers Fair, you would get these for free. So like, this was given to me by my uni, this was given to me by Unison, and I've got like a blue one for RCN as well. So you normally get these for free anyway, but if you don't have it, you can get one from like Argos or eBay, anywhere really. They are so important because when you're doing like vital signs and you need to like check the respiratory rate over a minute, pulse over a minute, things like that, they come in so handy because you can't guess those things. You can't guess. Some wards have clocks with the second second hand, you can't see them from everywhere. So that's where the issue is. So if I've been so many times when I've forgotten this and I'm kind of stuck, and I end up putting the timer on my phone. This is my daughter's phone, but I ended up putting the timer on my phone, just trying to you know, count a minute. However, if you've got the fob watch and it's on you, you're literally just, you know, looking up and you're counting it whilst you're doing the rest, you know, and it's just so much handier. Fob watches. Another essential, I think, is hand cream. So this size can fit into my pocket. As nurses, you're constantly washing your hands. You've constantly got hand sanitizer on your hands. Your hands become very dry, and then they start to crack, and you don't want that. So yeah, having hand cream is so important. You get just a small one. I don't know if there's any particular brand that is good and that's not good. For me, any hand cream goes. Any hand cream works. Just put it in your tunic, in your pocket, and it's just so much easier. So every time you wash your hands, once your hands are dry, just put on some cream and you're good to go. Okay, so another essential that I think is so important to have, and if I could go back to first year, this is what I would do. From my first placement ever, I would get an address book. I don't have one with me right now, but it's an address book with like the A, B, you know, like the olden days sort of books, like A, B, C, D, E, all the way up to Z. And the reason why I say it's so important is because when it comes to medications and it's hard for you to remember what is what and what it's used for. So I've seen it in practice with other people, and I'm like, this is such a good way to remember medications. What they do is on the address book, they've got all the different alphabets, and with every alphabet you can put in the medication and maybe what it's used for, like a brief sort of summary, and you can always go back to that, and it helps with your nursing knowledge and nursing and knowing what medications are used for what. So that's one thing I would do differently that I would advise you to get, which is an address book. Have that in your bag so that anywhere that anytime you've got a spare minute with your mentor, and let's say they've administered something to a patient and you just want to remember what that is and what it's used for, get your address book out and begin to write. Another must have is a bag. So this is not actually my nursing bag. My nursing bag's somewhere in the storeroom, but this is something like it. It's similar, however my bag is bigger. It's a big bag, and I got the bag, I'll put a picture somewhere here, but my bag has wheels. So what I noticed with us nurses is that you're constantly carrying things. Most of the time, for example, let's just say it's your shoes, you wouldn't want to wear the same shoes that you're wearing on the wards or in practice going home. You don't know what you've stepped on and all of that. Again, some people change their clothing, spare clothes. You've got your pad, you've got your pens, you've got your address book. You've got so many things that you're having to carry. And so for me, I'm not willing to break my back anytime soon. So what I do is I've got a bag that I can, it's like a little mini hand luggage, but I can also put it on my back if I wanted to. What I find important as well for community placements is having a waterproof bag like this, something you can wipe down when you come out from every patient's house. So even though you can put it into the ward, you want something that is easy for you to wipe down with antibacterial wipe. So yeah, waterproof backpacks work, I think, for me anyway. And yeah guys, I think that's about it. Like, that's my 9 things. However, I just want to add this on. You're most likely going to be getting one of these anyway from your trust, or from uni. Like, I've got so many lanyards, like so many. I've got so many. This is a uni one, but I've got so many. I've got even like more in my bag. But my thing is not necessarily the lanyard. Well, it is. It's like a 2-in-1. So your lanyard, which will have, I guess, your name tag. You've got a lot of cards or ID cards and stuff that is important. But my ultimate thing is having one of these. So this was given to me by my mentor. I've literally just clipped it on there. Don't know if you can see that. It's not focusing on this. There we go. So I've literally just clipped it on here, and I just find it so handy. So like when I've got this on, I can literally use my anti-back straight away. So having this on my lanyard just makes it much easier for me. It's not everything that can fit into my pocket. You've already got your notebook, you've got a pen, you've got your hand cream, like your pocket's already full. So I find it easier having this on my lanyard and I can just use it. So yeah guys, those are my top 10 essentials for placements. I hope you found them helpful. Yeah, if I remember anything else, I'll probably put it down below. But yeah, thank you so much for watching. Again, follow me on my socials and give me a big thumbs up, like, comment and subscribe, and I'll catch you in my next video. Bye for now.